Morocco orders 7 Ukraine-tested Rheinmetall Mobile Field Hospitals for combat care. Rheinmetall Mobile Systeme GmbH will supply Morocco with 7 highly mobile field hospitals under a contract signed in June 2026, adding deployable surgical, intensive care, diagnostic, and laboratory capacity for military operations and national emergencies. The company announced the order on July 3, 2026, confirming deliveries for 2027-2028 and a contract value in the mid-double-digit million euro range. The systems will give Morocco containerized medical facilities that can be moved by truck and operated near combat zones, disaster areas, or damaged civilian health infrastructure. With 1 hospital assigned to the Ministry of Defense and 6 to the Ministry of the Interior, the procurement strengthens both battlefield casualty care and large-scale crisis response. The technical content of the Moroccan order is medical equipment rather than armament, but its operational effect is still directly military. A field hospital of this type reduces the distance between the point of injury, damage control surgery, intensive care, and evacuation, which is a measurable factor in force preservation. Rheinmetall says the Moroccan systems are based on medical solutions developed for and field-tested by the Ukrainian Armed Forces, an important reference because Ukraine has forced medical units to operate under artillery, drone, missile, and infrastructure disruption conditions rather than in permissive rear areas. The Moroccan configuration is truck-mounted when deployed and can be expanded with military tents for off-truck functions, meaning the hospital can remain mobile while still creating enough workspace for triage, patient holding, staff movement, and support functions. EZOIC. The core of each Moroccan field hospital is the operating theater complex, composed of a modern operating room, an intensive care unit, and sterilization facilities installed in expandable shelter containers. Around that core, Rheinmetall lists patient accommodation, X-ray, pharmacy, laboratory, ophthalmology, dentistry, ENT, and a CT scanner, which places the hospital above a simple first aid or evacuation node. The CT scanner is particularly relevant for military trauma because it allows diagnosis of head injuries, internal bleeding, spinal trauma, and complex fractures before surgery or evacuation. X-ray covers more routine fracture and shrapnel assessment, while the laboratory and pharmacy support blood work, infection control, medication storage, and controlled distribution of consumables. The sterilization unit is not a secondary detail. Without it, repeat surgery under field conditions becomes dependent on external sterile supply chains, which are vulnerable during dispersed operations or after damage to roads and hospitals. Rheinmetall's wider mobile hospital catalog explains how these medical shelters are normally scaled. The company offers standard hospital sizes of 50, 100, and 200 patient beds, although each customer configuration is tailored to the mission and medical requirements. Its ZPPLN shelter design is used in fixed 1:1 form or expandable 2:1 and 3:1 layouts for Role 2 Basic, Role 2 Enhanced, and Role 3 equivalent treatment facilities. Modules can be connected by corridors or connecting shelters to create a hygienically controlled medical chain. At the same time, tents can be added for triage, patient accommodation, catering, or other lower-risk functions. Rheinmetall also states that its turnkey systems include the required support equipment for electricity, water, sanitation, catering, and waste disposal, which is essential because a hospital that relies on local grid power or municipal water loses much of its value in a disaster zone or contested rear area. The closest public benchmark is the mobile field hospital that Rheinmetall transferred to Ukraine in September 2023 under a German Ministry of Defense contract worth about $9 million. That hospital had 32 patient beds, including 8 intensive care beds, 1 operating room with sterilization, X-ray and CT imaging, laboratory, pharmacy, and administrative and personnel areas. Rheinmetall said the 20 containers were transported by 10 truck and trailer combinations. It also included independent power generation, medical gas production, its own water supply, water treatment and decontamination, billets, and sanitary modules, with a spring-loaded transport arrangement for the CT scanner to protect sensitive equipment during movement by land, sea, or air. These details matter for Morocco because they show the logistics footprint likely required by a complete Role 2 class hospital, not just doctors and equipment, but trucks, fuel, water, oxygen, medical gases, sterile processing, spare parts, and trained personnel able to erect, operate, dismantle, and redeploy the facility. In NATO medical terminology, the Moroccan purchase aligns with the functions normally associated with Role 2 Basic and Role 2 Enhanced Care. NATO capability documents define Role 2 Basic land and high mobility treatment facilities as able to provide damage control surgery and emergency surgical procedures, while Role 2 Enhanced adds general, emergency, and secondary health care built around primary surgery, intensive care, and nursed beds. NATO's modular approach also identifies CT scan, ward, intensive care, laboratory, pharmacy, dental care, sterilization, and other specialties as enhancing modules that can be added to a Role 2 basic medical treatment facility according to mission needs. Morocco's listed equipment package therefore resembles an enhanced deployable medical treatment facility rather than a minimal forward aid station.